Intermittent fasting has been growing in popularity in recent times, not only as merely a way to lose weight, but for overall general health of the body and mind.
Although fasting for a week or two can actually interfere with the loss of body fat, eventually, after the third week of fasting, fat loss starts to overtake the loss of lean body mass in obese individuals. But is it safe to go that long without food? Proponents speak of fasting as a cleansing process, but some of what you're purging from your body are essential vitamins and minerals. Heavy enough people can go up to 382 days without calories, but no one can go even a fraction of that long without vitamins. Scurvy, for example, is diagnosable within as few as 4 weeks without any vitamin C. Beriberi, thiamine, or vitamin B1 deficiency, may start out even earlier in fasting patients, and once manifest can result in brain damage within days, which can eventually become irreversible. Even though fasting patients report problems such as nausea and indigestion taking supplements, all the months-long fasting cases I've mentioned in the last few videos were given daily multivitamins and mineral supplementation as necessary. Without supplementation, hunger strikers and those undergoing prolonged fast for therapeutic or religious purposes, like the Baptist pastor hoping to enhance his spiritual powers for exorcism, have ended up paralyzed, comatose, or worse. Nutrient deficiencies aren't the only risk. Reading about all the successful reports of massive weight loss from prolonged fasting in the medical literature, one doctor decided to give it a try with his patients. Of the first dozen he tried it on, though, 2 died. Now, in retrospect, both of the 2 patients that died started out with heart failure and were on diuretics. Fasting itself produces a pronounced diuresis, meaning loss of water and electrolytes through the urine, and so was the combination of fasting on top of the water pills that likely depleted their potassium and triggered their fatal heart rhythms. The doctor went out of his way to point out that both of those who died started out in severe heart failure, and both had improved greatly while undergoing starvation therapy. Small consolation, since they were both dead within a matter of weeks. Not all therapeutic fasting fatalities were complicated by concurrent medication use. At first, he did very well and experienced the usual euphoria. His electrolytes remained fine, but in the middle of the 3rd week he suddenly collapsed and died. This line of treatment is certainly tempting, because it does produce weight loss, and the patient feels so much better, but the whole killing people thing must make it a very suspect line of management. Contrary to the popular notion that the heart muscle is specially spared during fasting, the heart appears to experience similar muscle wasting. This was noted in the victims of the Warsaw Ghetto during World War II in a remarkable series of detailed studies carried out by the ghetto physicians themselves before they themselves succumbed. In a case entitled Gross Fragmentation of Cardiac Fiber After Therapeutic Starvation for Obesity, a 20-year-old woman successfully achieved her ideal body weight after losing 128 pounds fasting for 30 weeks. After a breakfast of 1 egg, she had a heart attack and died. On autopsy, the muscle fibers in her heart showed evidence of widespread disintegration. The pathologist suggested that fasting regimens should no longer be recommended as a safe means of weight reduction. Breaking the fast appears to be the most dangerous part. After World War II, as many as 1 out of 5 starved Japanese prisoners of war tragically died following liberation. Now known as refeeding syndrome, multi-organ system failure can result from resuming a regular diet too quickly. See, there are critical nutrients such as thiamine and phosphorus that are used to metabolize food. So in the critical refeeding window, if too much food is taken before these nutrients can be replenished, demand may exceed supply, and whatever residual stores you still carry can be driven down even further, with potentially fatal consequences. That's why rescue workers are taught to always give thiamine before food to victims who had been trapped or otherwise unable to eat. Thiamine is responsible for the yellow color of banana bags, a term you might have heard used on medical dramas, used to describe an IV fluid concoction often given to malnourished alcoholics to prevent a similar reaction. Anyone with negligible food intake for more than 5 days may be at risk for developing refeeding problems. Medically supervised fasting has gotten much safer now that there are proper refeeding protocols. We know what warning signs to look for, and we now know who shouldn't be fasting in the first place, such as those with advanced liver, kidney failure, porphyria, uncontrolled hyperthyroidism, and pregnant and breastfeeding women. The most comprehensive safety analysis of medically supervised water-only fasting was recently published out of the True North Health Center in California. Out of 768 visits to their facility for fasts up to 41 days, were there any adverse events? Yes, 5,961 of them, but most were mild, known reactions to fasting, such as fatigue, nausea, insomnia, headache, dizziness, upset stomach, back pain. They report only 2 serious events and no fatalities. Fasting longer than 24 hours, and particularly 3 or more days, should only be done under the supervision of a physician, and preferably in a live-in clinic. In other words, don't try this at home. This is not just legalistic mumbo-jumbo. For example, normally, your kidneys dive into sodium conservation mode during fasting. But should that response break down, you could rapidly develop an electrolyte abnormality that may only manifest with nonspecific symptoms like fatigue or dizziness, which could easily be dismissed until it's too late. The risks of any therapy must be premised on the severity of the disease. The consequences of obesity are considered so serious that effective therapies could have considerable acceptable toxicity. For example, many consider major surgery for obesity to be a justifiable risk. But the key word is effective. Therapeutic fasting for obesity has been largely abandoned by the medical community, not only because of its uncertain safety profile, but its questionable short-term and long-term efficacy. Remember, for a fast that only lasts a week or 2, you might be able to lose as much body fat or even more on a low-calorie diet than a no-calorie diet.